All right, we are talking about legal cannabis and cannabis use disorder.
Yes.
Kind of talk us through this.
So this is a new study from JAMA Psychiatry, large peer-reviewed journal, and it's looking at the rate of use disorder, those who might have addictions, dependence, or tolerance to cannabis, marijuana, or weed across the country between the years of 2011 and 2021. Now, that's important because between those years became legalization and recreational use, and they found some important and disturbing numbers. The rate of cannabis use disorder increased by 43%.
Wow.
The rate of poisonings from cannabis, those are the patients that come in with a variety of different symptoms, has increased by more than 85%, especially in states where there's more recreational use. Now, when I read these studies, obviously these numbers, when you start to allow more recreational use, you will see more of the negative effects, but I don't want to discount some of the benefits that some find with cannabis use, some treating it for anxiety, some for seizure disorders, some surviving cancer. But with that being said, like any medication or any treatment, there is a use or a possibility of harm that you have to recognize.
So how do you know if you have a use disorder and what can you do about it?
I'm so happy you asked that because there are important qualities that I think many are not aware of that they might be having in their everyday life. Number one, do you have an addiction? When you try to stop quitting, can you stop? That can be a sign of an addiction. When you're stopping, do you feel less than? Do you feel a weaker version of yourself when you're not using? That can be a dependence. When you're not using, do you feel worse? That can be signs of withdrawal. All of these are components of use disorder, and some might have many symptoms of this, some might have a few. So it's all about recognizing.
And what can you do about it?
Talking to your provider, talking to your friends, making a plan to cut back, and then understanding that if again, you cannot without the help of assistance, reaching out for help and talking to your provider about use disorder assistance.
Good to know. Dr. Darien, thank you so much.
Of course.